Your operation at East Surrey Hospital. Step 1. The outpatient appointment. Our outpatient department provides a comprehensive service across a wide range of surgical specialities. You will need to be referred for an outpatient appointment by your GP or another doctor. Here you will meet a member of the surgical team who will assess your condition and give you the information you need to help you decide upon your preferred treatment options. You may need tests, such as scans or several visits to the clinic in order to complete your consultation. There can sometimes be a lot of information to take in, so it may help to have a friend or family member with you. Your surgeon will explain in detail the benefits and risks of each treatment option to help you make a fully informed decision. You will be given information to take home, and your surgeon will send letters to you and your GP to summarise your clinic discussions. If you decide upon an operation, we will then start organising your surgical visit. Step 2. The pre-assessment appointment. The pre-assessment clinic is where we assess your general health and begin planning your particular needs for surgery. You will be seen by a pre-assessment nurse who will ask about your general health, fitness, previous operations or illnesses. The appointment could last up to an hour, depending upon which assessments you require. Please bring your current medicines prescription if you have one. You may need a physical examination, so please wear loose-fitting clothes. Oxygen levels, blood pressure readings, an ECG and blood tests may be taken. If we find you have problems we were not aware of, such as high blood pressure, you will need to visit your GP for treatment. You will be provided with written information on your specific surgery, including the number of days we expect you to be in hospital for. If you have more complex medical conditions, you may be sent a separate appointment to see a consultant anaesthetist. If your health changes after your pre-assessment appointment, then please contact the pre-assessment unit. Step 3. The day of your operation. The time you arrive may be a few hours before your operation. Remember to follow the instructions given to you at your pre-assessment appointment about taking or skipping any morning medicines you usually take. During the admissions process, you will be seen by a nurse. They will help prepare you for your surgical procedure. Your nurse will talk you through what to expect during your surgical admission. You will be given an identification wristband, which confirms your details in the operating theatres. Your blood pressure will be measured, along with several other quick health checks. Some of you will need a blood test too. You will be provided with blood clot prevention stockings and a gown to change into. Some female patients may need to supply a urine sample. We will give you a patient property bag so that your clothes and other belongings can stay with you throughout your time in the operating theatre. A member of your surgical team will remind you about the important details of your surgical procedure. Feel free to ask any questions about the surgery or your expected recovery. If not already completed, then your surgeon will take you through the consent form. Please be aware that the time of your operation will not be finalised until the list of operations is discussed in the theatre team briefing. The theatre team briefing occurs just before the surgical list begins and allows us to best meet any changes in requirements of the patients on the day of surgery. During the admissions process, you will also meet your anaesthetist, who will discuss your anaesthetic options. This may vary, depending upon your medical needs and surgical procedure. Pain-relieving methods and whether you may need any special care after surgery will be discussed. We try to avoid it as far as possible, but some of you will need to wait before going to theatre. We know waiting can make you nervous, so we will keep you updated. If you are thirsty, check with the nursing staff about drinking water. Please also notify them if you feel you need to take any pain relief. Step 4. Going for your surgery. When it is time for your operation, you will be accompanied to theatres by a nurse. Those of you in Princess Alexandra theatres, which are on the level above admissions, will get changed into a gown in a private room in admissions. If your surgery is in the main theatres, then there is a short walk into the main hospital building. The pre-operative patient preparation area is where you will wait just before being taken into the anaesthetic room. You will be transferred to an operating theatre trolley. Nursing staff will recheck your details and try to help you relax if needed. The theatre practitioner will meet you and take you to the anaesthetic room. The type of anaesthetic you will have will depend upon your surgical procedure. Your details, consent form and relevant paperwork will be checked several times prior to surgery. Your anaesthetist will insert a cannula into a vein. The cannula is a small, flexible plastic tube used to give medications into the vein, including anaesthetic drugs, painkillers and antibiotics. Not all surgery requires you to be asleep. Your anaesthetist may have already discussed nerve block or spinal anaesthetics with you. These anaesthetic techniques allow pain-free surgery on limbs or the lower abdomen, allowing surgery to be performed awake or with sedation. If you require a general anaesthetic, then you will be given an oxygen mask before going to sleep. You can hold this yourself if you prefer. You may feel a cold sensation where the anaesthetic goes into the vein. This is nothing to worry about, and the sensation will not be there when you wake. Your anaesthetist and the surgical team will take care of all your needs throughout your operation. Following surgery, you will be transferred into the post-anaesthetic care unit. The anaesthetic and theatre teams will hand over to your recovery nurse. It may take some time for you to feel fully awake after a general anaesthetic. You may be thirsty or have a sore throat. Extra pain relief can be provided by the recovery nurses. When you are ready to go to your post-operative ward, you will be collected by a ward nurse. We can let your next of kin know your operation has been completed. Your care will be handed over to the ward nurse. You will be taken by a porter with the ward nurse to your post-operative ward. It is common after major surgery for patients with complex medical problems to be cared for in the high dependency or intensive care units. If this applies to you, then you will be informed at pre-assessment clinic or by your anaesthetist. Step 5. Recovering after surgery. You will be reviewed by your surgical team on a daily basis. The length of time it takes to recover from surgery will vary, depending upon your operation and your body's response. Ward staff will monitor you very closely over the first 24 hours after your surgery. Pain after surgery is to be expected, but pain relief options that have been discussed will be in place. With advances in surgery and anaesthesia, our patients are now recovering much quicker. However, you may still require fluids and medications in the days after surgery. You may be visited by specialist nurses depending upon your operation. Following most operations, we encourage you to move around and eat as soon as possible. Nursing staff will always be on hand should you have any questions or concerns during your recovery. Step 6. Leaving hospital. If required, the physiotherapists will visit you. They will provide exercise programs and offer help and advice if you have any difficulty with mobility. Therapists can also provide any additional equipment you may need to ease the transition from hospital to home. Before you go home, you will be given any medication and equipment you require. details of your follow-up appointment and contact details for the ward. On your day of discharge, you may be asked to wait in the discharge unit. This area provides full nursing support as well as refreshments. We want to hear what you think of the care you received. Please take part in our Your Care Matters feedback programme to help us continually improve our service to you. We hope your surgical stay at Surrey and Sussex Healthcare NHS Trust will meet your expectations.